Bowling.
Chris Fire.
Brad Johnson.
Bottom line.
Bottom line Thursday, Brad.
Brad, you had a fantastic newsletter, so good that we're going to do a part 1 and a part 2. So we're going to do part 1 now, talking about, you had covered this last year, a very large survey, over 17 million people surveyed. Tell us a little bit about what you found out.
Yeah, so, part of being the data geek, right? You got to get data points from all over. So we want to listen to insurance carriers, right? Their trend surveys we check out. Accounting firms like PricewaterhouseCoopers does one, but it's always interesting to hear what employers are predicting for their costs, right? Because the other two, well, let's say from the carrier side, they're probably going to pad their trend a little bit, right? They don't want to be wrong, so they're going to guess high.
Yep.
And accounting firms, that's probably a decent survey of things. But what those large employers are doing, I'm really curious about. So the National Business Group on Health, that's a group I'll quote a lot. They represent over half the Fortune 500 and a ton of municipal groups nationwide. I think
some jumbo employers, really. That's big. Yes.
Yeah. I want to say like almost 20% of covered people in the US would be covered by some of these firms, which is crazy. But they ask their members, what are you budgeting for next year for your healthcare costs effectively? And they're using 8% as their starting point.
Wow.
And they think through probably plan design changes, which has gone on for decades, right? They can probably get it down to 6%. But still, what was surprising to me, that 8% was spot on to the PricewaterhouseCoopers survey I just saw doing that same number.
Yeah. But I'm sure it's like everywhere. If you're not doing something creative with pharmacy, doesn't matter how big you are, you're still not going to be able to control those costs. I'm sure that we're still unhealthy and there's all kinds of things that are still hitting those plans, but 8% for a jumbo employer makes me a little nervous for the small employers, unless that's going to be trend across the entire market.
Yeah. And, to your point, Chris, I'm almost wondering if you read the survey, because one of the top concerns was the rising pharmacy costs. And guess which subset?
I might have, Brad. I might have.
GLP-1. Yep, you guessed it.
Yep.
And then that high cost cancer claims. And what was interesting too, they are seeing it hit younger members of the population than ever before. So the treatments are more expensive than ever before, but also hitting more people than before, which is obviously concerning. MSK, which is usually 1 or 2 in every group, top 1 or 2, I should say.
Yeah.
And then cardio conditions now reach the list. It wasn't on the prior ones. So, kind of indicative of what we all see, but when the jumbos are saying it's a problem too, it's probably a problem.
But I think it's what we talked about before. It's not the size of the employer, it's what they're doing that's different. Because you look at the conglomeration that Amazon started, and you've got all these large employers coming together to fix healthcare, but they didn't really do anything different other than say we're bigger and we can purchase more. I mean, that isn't working. There's got to be different things done to control costs, be more creative than just we're aggregating 1 million, 2 million, 3 million lives. It just doesn't work.
100%.
Yeah.
Well done.
Interesting. So part 1.
Part 1. So part 2, stay tuned. We'll do individual next.
Thanks, Brad.
I love it. Sounds good.
Right.
Thank you.
See you guys.
All right, we'll see you guys.